Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the Graves disease. It is started on the BB and the methimazoles 20 mg daily. 2 to 3 weeks later, hyperthyroid symptoms are improved. FT4 has come down to 2.6 and BB and methimazoles are continued. Patients return the 6 weeks later with the complaint of fevers and sore throats. Reassure her that she has the viral infection. Second, check the CBC, hold the methimazoles until result obtained. Stop the methimazoles and refer to endocrine. Change from the methimazoles to PTU. Patient returns 6 weeks later with the complaint of fever and sore throat. Reassure her that she has a viral infection. Check the CBC, hold methimazoles until results obtained. Stop the methimazoles and refer to endocrine. Change from the methimazole to PTU. Side effects of the thianamides: agranulocytosis. Less than 70% develop agranulocytosis within 60 days, nearly 85% within 90 days. Most points presents with the fever 92% and sore throat 85%, and thus point instructed to call if they have fever and sore throat. Check the WBC. Hepatotoxicity more common with the PTU but can occur with the methimazole. Also, next is there are the case of the side effect of the thianamides, and their case 73 young AF, and there are the hyperthyroidisms, discontinuations of the profile uracils day ago of the planned thyroid uptake and scan. Presents the day slurred speech and low grade temp on the day of the admission. Case for physical exam, heart rate is 120 to 170 on the telemetry. Temperature is 100, very lethargic. Hands, stare and ID lag. There is the lead lag, no proptosis or the sclera ancestral. Neck is thyroid and large and nodular, no breath. Rhythms but tachycardia. Fair respiratory effort, no crackless. Brisk reflexes, fine tremor present. And what are the concerns about? Thyrotoxicosis features are the accentuated thermoregulatory dysfunction and the low grade temperature. Thyrotoxicosis features are accentuated and the thermoregulatory dysfunctions, low grade temperature. Cardiovascular tachycardia is the large than 140. CNS disturbance, agitations, delirium, psychosis, extreme. There are the seizures, coma, jaundice, and also apathetic hyperthyroidism may present with the apathy. Cardiac failure, elderly or those with the non-thyroidal illness may not have typical signs and symptoms of the thyrotoxicosis, which can lead to delay in the diagnosis. In today's class, I discuss about the following: thyroid clinical representation and thyroid storm, side effects of the thianamides. Thank you for watching.